Not seeing any seizure activity in response to low-frequency sounds. I'm starting him on mid-range.
Have you seen his girlfriend? Extremely hot.
Blind people can't have attractive girlfriends?
Not my point. He actually convinced her to go for the whole relationship break thing.
How do you know it wasn't her idea?
Because she's back with him. Women suggest a break when they want to break up. Men do it because they want to have sex with other women before they settle down.
They're a little young to get married, don't you think?
I was their age when I did. I see your point.
He's seizing. Sound frequency's at 300 hertz.
It's not a seizure. He's not spiking on his EEG. He's not moving air. I think he's choking on something.
Blood. I don't see any blockage.
Help me move him.
Just relax and breathe.
What are these?
Where's Park?
Wilson's babysitting her. Talking about the fact that she could have permanent brain damage. Might bum her trip out a little bit.
Dark spot doesn't necessarily equal brain damage. It could be a congenital malformation connected with his blindness or a tumor.
A clot.
Exactly. We need to do another scan, but inject dye.
I said a clot, not or a clot. It's a clot. Cerebral venous sinus thrombosis.
The good news for Park, but I've never seen one present this large before.
It fits. When it was smaller, it caused his initial disorientation and hallucinations. As it grew larger, the seizures.
And if left untreated, leads to cerebral edema and death. But what causes that and tooth loss?
Any hypercoagulable state. Lupus?
I counter your lupus with Behçet's syndrome.
No, he doesn't have any of the earlier symptoms. Color blindness, abnormal visual fields, or... We've been ignoring his eyes because he's blind.
Well, if he wasn't before, he would be by now. Confirm with an eye exam, start treatment with heparin for the clot, interferon and steroids for the Behçet's.
There's fresh scarring and swelling in both fundi and a bleed on the left. House was right. It's Behçet syndrome.
Give it to me straight, Doc. Am I ever gonna see again?
That's a little out of our jurisdiction. We need to wrap a dressing over your eyes to keep the light out.
It's not really a problem for me.
You might not see it, but your tissue does. It'll also help with the swelling. Leave you in Dr. Adams' capable hands.
Somebody help me!
Will? It's Dr. Adams and Dr. Chase. We just need to know where you...
My eyes! It feels like it's on fire!
It's not Behçet's. It's necrotized tissue like this. I think it's Streptococcus pyogenes.
Except we've already treated him with broad-spectrum antibiotics. Shouldn't be spreading. Should be dying.
Just means it's drug resistant. We need to remove what's left of his eyes before the gangrene sets in.
It's something that looks and acts like a bacteria but isn't one. Could be viral.
No, it couldn't. No evidence of viral markers in the necrotized tissue.
You see that image you took last night of the clot in his lung? That's not a piece of the clot from his brain. That's the point of infection. Mucormycosis. He breathed in the spores. It's been growing and spreading ever since.
Fungal infection spreading this fast?
Kid's diabetic. He already has a compromised immune system.
He's right. The sample from his eyes is crawling with it.
Treat with amphotericin B.
We treated him with gentamicin when we thought it was bacterial, which means a dose of amphotericin B will need to cure him. Will probably leave him deaf.
Sorry. Stop listening after you said the dose will need to cure him.
Blind and deaf. I'd rather be dead.
You will be.
I can live with that. You never did get my humor.
There's a chance your hearing won't be completely gone.
How much of a chance?
A small one, but a chance.
I'm refusing treatment. You don't know how hard things are already for me. I can't handle anymore. I can't. Why'd you come back?
Because I love you. And I want to be with you for as long as I can.
Melissa, I'm so scared.
Me too. I'll always love you.
Even if I was deaf.
Even if anything. Is it working?
He's still very ill, but if he keeps responding the way he has been, he should be fine.
And his hearing?
It's gone. We don't know yet if it'll be permanent.
Melissa? Is that you?
We've been squeezing his hand once for yes, twice for no.
Can I ask you something? I completely understand if you squeeze no. Will you marry me? Don't leave me hanging now.
Yes. Yes, of course, yes.
I heard that. You said yes, right? You said yes.
He's got a temperature of 103.
And why do we care?
Because we're human beings. That's what we do. He said he was at a luncheon meeting.
You took his history?
Guy looks like Harpo. You should see him.
You asked him what book he's currently reading.
It's hilarious to watch him try and talk. I asked him anything I could think of. Favorite color? Whoa. Favorite dessert topping? Trust me, you never know what fact may prove the key to saving your life.
Whipped cream.
I asked him if he was sure. Where you going?
You're an ass.
I know. Where are you going?
This is either a toxin, an infection, or an allergic reaction. I assume you gave him epi, so that rules out allergies. Put him on antibiotics in case it's an infection. And if it's a toxin, we'll keep him here overnight, let the swelling go down, send him home. I'm going to the movies. I would have bet money something would go wrong. Let's rotate him back. He's bleeding into his ocular orbit.
LP wouldn't do this.
Lots of pressure behind. Got to relieve it.
What's going on? What are they doing?
It's important that you're up ASAP after surgery. Think you can urinate? What, are you getting aroused?
No! Not that part! It's not stopping!
Surgeons found no evidence of a burst artery.
The blood had to come from somewhere. You took a shower in it.
Trauma?
You think someone snuck in here just to kick him in the jewels and poke out his eye and swell up his tongue? Keep writing. I got a bet with my physio that I can do 100 clicks by Friday. What about blood from the kidneys?
Kidneys drain into the bladder, which drains into the ureter. There's no way it would mess with the scrotum.
Yeah. Basic human anatomy. Therefore, I think it's safe to assume that the problem lies elsewhere. But given that this case doesn't make any kind of sense whatsoever, maybe we should even question the basics.
Maybe he's not human.
An anatomical defect would seem more likely, but let's not rule that one out.
Even more likely, he is human. His anatomy is where it's supposed to be, but he has testicular cancer.
We tested for cancer.
We tested the lymph system in his chest.
Surgeons found no growth.
Surgeons was trying to put it.
You're drawing those lines instead of looking at the cards.
More juice?
What's more juice? He has to ask for it. Adam? Buddy, eyes here.
He's tired, Dom.
Wouldn't be if we stuck to the schedule. Show me the juice, buddy.
I think we've reached the point of diminishing
He has to
returns.
ask for it. Adam!
He's choking.
It's impossible. It's mac and cheese.
I'm sorry, you can't come in here.
What's going on?
Is it V-fib?
Here you go. Charge.
Clear. Charging, clear. Charging, clear. Charging, clear.
He's stable for the moment. First degree atrial ventricular block.
Okay. What else do we know?
His liver's damaged, pleural effusion compromises lung function.
Biopsy was negative for cirrhosis. Parents didn't poison their son.
It's not his liver, his heart, or his lungs. It's the calcium carbonate in his stool.
Kid was constipated. Parents probably just overdid it.
Or they didn't do it at all. Calcium carbonate's also what's in chalk.
So he ate some chalk. It isn't toxic. Sure, it didn't cause a pleural effusion.
Forget the chalk.
You just said it was about the chalk.
Yes, and then I said forget the chalk. He must be very confused. This kid's got pica. Take him to a buffet. He's gonna eat the table.
Or lead paint.
Level of lead in the blood was normal. His tox stream was clean.
We're not looking for typical poisons. We're looking for anything that he can put in his mouth. Matches, spiders, bricks.
Pressure-treated wood used to contain arsenic.
Even better. Hansel, get samples of the gingerbread house. Bag everything. Ever see your son eat a bush?
I haven't.
I've only ever seen him eat with
Adam, you ate something at your house. Something that made you sick. I need you to show me what you ate.
Can't answer you.
Neither can you. This is your backyard. You may know it as Mel's Diner. This is your sandbox, your jungle gym. And under it is this. I need to know if you ate this, Adam.
He doesn't know what you want.
Adam, you have to tell me. Because if you don't, it'll be game over. You'll be dead.
What the hell are you doing?
Show me what you ate. Adam, show me what you ate.
Adam?
Honey? Adam?
Come on in, brothers and sister. Welcome to the house of the Lord.
House, come on. The chapel?
We have been blessed with the miracle of a new symptom. Brother, can you testify as to why this poor child's eyeball rolled back into his head?
It's consistent with Jimson weed poisoning, ocular paralysis. Sorry.
The wicked shall deceive you because they have turned from the Lord and are idiots. His ocular muscle didn't paralyze, it pirouetted.
MS.
It is easier for a wise man to gain access to heaven.
Can you stop doing that? Just say not MS.
Stroke. Bleed in the brain.
Be seeing other symptoms besides a single eye misalignment, like a coma. You've already testified.
It's a tumor.
And all the imaging just missed it?
It's a microtumor. It started in his lung, which caused a pleural effusion. Then it metastasized to his liver, which made it slough cells. And then went to his brain, behind the eye, which caused it to roll back into his head.
So he has 3 tumors, and we missed all of them. What's the opposite of a miracle?
I have a better chance of finding it now that I know exactly where to look. So, unless you have a better idea, I'm gonna go CT his head. And then if I have to, remove his eye.
You remove this kid's eye, he's only gonna be half as good at not making eye contact. Hey! Don't touch his eye.
This is an appendectomy.
Like I said, don't touch his eye. Why isn't he in surgery?
Some emergency bumped him. We've got another room in 10 minutes.
You're not taking him in. Kill the lights. He was seeing them all the time.
What are you looking for?
He was telling us what he was seeing, telling us exactly what was wrong with him, drawing them for us over and over again. But nobody knew how to speak autistic. When I asked him what he ate, he even told me that.
What are you talking about? What was he seeing?
Hello, my pretties. It's not a tumor, Foreman. It's worms swimming in his eye. Animal makes potty in the sandbox. Boy plays in the sandbox. Boy eats the sand. You can probably tell where this is going by now.
Stool samples were negative for parasites.
Raccoon roundworms are not excreted by their human host.
Cameron tested the sand.
All of it? Worms spread from his gut to the rest of his body. They attacked his lungs. That's what made him scream and caused the effusion. They invade his liver, sending dead liver cells coursing through his system. They attack his eye and the muscles surrounding it, making his eyeball do a backflip. Laser photocoagulation to fix the eye and a high dose of benzimidazole to kill the worms.
Wait a minute. That's it? He's gonna be okay?
Good news. He's gonna be with you for a long, long time. You have a resume there. I'm not interested. I wouldn't mind hearing how you got my pager number.
It's not a resume. $50,000.
Does one-eyed Nicky want me to run that to Jimmy the Nose?
It's for my medical bills. I need you to find out what's wrong with me.
Insurance is usually cheaper than that. Cash means there's something to hide.
I'm a captain in the Air Force about to start a new assignment. NASA's astronaut training program.
I discovered salt and created FM radio.
Something is wrong with my eyes, my ears.
Well, if it's fixable, the Air Force will do it for free. If not, it doesn't matter.
There are 100 applicants ready to take my place who don't need to be fixed. I need to do this off the books. I did the research. You're the best, you break rules, and you don't care about anyone except yourself.
Let's say that's true. You get a new job. Hospital gets a nice wad of cash. What do I get?
I crashed a flight simulator because I started to hear with my eyes.
The aluminum could have been tainted.
Don't care. New patient. 30-year-old female with synesthesia. New rules. You generate a lab report, you shred it. X-ray, you melt it. No notes, no records, nothing. As far as you're concerned, the patient is Osama bin Laden, and everyone not in this room is Delta Force. Any questions?
We're protecting Osama bin Laden?
It's a metaphor. Get used to it. Any more questions?
And you're not even gonna tell us her name?
You think her name might be connected to what's wrong with her? Here's Osama! you all have numbers, so we're going to do this alphabetically. 8, 15, and 5.
Is the synesthesia new?
Yes.
Any history of similar symptoms or psychiatric?
No, nothing.
Are you on any prescription meds or use any other drugs?
No.
Should we trust her answers?
Do you think I'd pull you off Buddy Ebsen just for a junkie?
Can we trust your answers?
You got to trust someone, right?
No. Has anyone close to you been sick lately? A family member, a coworker?
No, not that I'm aware of.
2 down, Kitty Carlisle.
You spend much time above 20,000 feet?
Why would you ask that?
People who fly are immobile for long periods. Could be a leg clot that embolized to the brain through a PFO.
It's an unusual choice.
Well, like you said, you wouldn't interrupt Buddy with anything that wasn't.
The patient is a frequent flyer. 13, 32, 39. Get Osama an EEG, MRI, and angiogram.
Yeah, I think she's having a heart attack.
No, I just feel a little funny.
Tachyarrhythmia.
Call the code!
Nothing.
Fib. Hey, where the hell is clear?
You crazy? You can't use those.
We're in a hyperbaric.
She's on fire!
Her heart's beating, and we are so fired.
The hormones stimulate your thyroid. Don't worry if you get flushed or you start to sweat. It means the thyroid's working. And if you want, I can remove that mole. I'm a plastic surgeon. You're allowed a little vanity.
I'm fine with the way I look.
Good for you. Although I do find it a bit odd that someone so self-assured doesn't want her doctors to find out what's wrong with her.
What are you talking about? Why else am I here?
You're jerking us around. You're handcuffing us with all these restrictions.
Feeling warm.
Her pulse is 120. Stop pushing. If House thought this would handicap us, he wouldn't have taken the case.
Or maybe that's why he took the case. He wants to see if we can get out of her on our own.
What did you find at her home?
You were in my home?
Nothing.
Travel pictures, yearbook, her name on an employment slip.
We weren't checking for that stuff, okay? Obviously, House didn't want us to.
You're gonna out me, aren't you? You're gonna ruin everything.
Nobody's trying to do anything. Just relax.
This is not a normal response. The test pulse and BP are too high.
Get away from me. Get away from me. Don't touch me.
We need to stress the patient's liver.
You mean make her sick?
I mean, make her sick in a specific way. If her liver is given to malfunctioning, we make it malfunction.
Are we on the other side of wrong here? Don't we have an ethics board that we should consult? Or...
I fired you.
No, you didn't.
He fired you. You're number 6.
No, I'm not. I'm number 9.
I approve of your shamelessness. You're still fired. So how do we stress her liver?
Lying in paperwork I get. Shutting down organs.
We could give her intravenous vitamin D and stick her in a tanning booth. If she goes into a coma, we know it's a metabolic problem.
Nice. If vitamin D is metabolized by the liver and kidneys, it wouldn't tell us which one's screwed up.
We could get her wasted. Give her shots of tequila, measure how long it takes for her to pass out. If it's too fast, then we know her liver's not processing alcohol. It means it's shot.
I like you, number 9.
She was having trouble breathing, refused oxygen and intubation.
So you put her on a treadmill.
Records will show that we gave her oxygen as a part of a routine cardio stress test. If she gets to breathe, your boss gets her paperwork.
Whose idea was that?
It's a joint decision.
It never is. So how old were you when your brother left home?
Why do you think that
Why aren't you answering? Did your mother initiate the divorce?
We should probably focus on what's wrong with her lungs.
Are you a Wiccan?
She really can't breathe.
Okay, hold still.
What are you doing?
Auscultatory percussion. If you have a good ear, you can... I didn't have a lot of friends because you
You
chose
can hear while you're talking?
You can detect not only structural details, but small, deep masses. game's over. You either have lung cancer or tuberous sclerosis. We need to cut you open and biopsy.
That'll leave a scar. As the doctors will see, they'll know.
I never opened for Springsteen or slept with Barbara Feldon. You can live for years without dreams, without lungs.
I'll find a way.
Okay? As long as you keep saying it strongly, you won't die.
Fine. Away.
How do we force a patient into surgery? Texas bag scam? Saratoga wire? Paris exposition trick?
The problem's not the surgery, it's the scars. And we have a plastic surgeon here who can hide them.
Not that well. NASA's gonna check every cranny.
I say we just put ether in her oxygen and do what we have to do.
She'll sue. Oh, for what? Making it harder for her to lie to the government?
We don't need to hide them. We give her elective cosmetic surgery. The incisions will give us access to her lungs, and she's got an innocent explanation for the scars.
You mean like liposuction?
No. Those incisions are too far from the lungs. We don't subtract. We add. Turn her B's into C's.
It's a myth that fake hooters blow up at high altitude. She'll be fine. Just think of it as one giant rack for mankind.
I fought for years to be taken seriously.
Trust me, you'll be taken more seriously. Just sign the form.
This'll make me a joke. There's gotta be another way.
I've known a few people who had dreams. One thing they all had in common was they got laughed at, and they didn't care.
So, I'm cured.
You're fine for now, but von Hippel-Lindau's a genetic disease. There's no cure.
Greta, you need to come clean to NASA.
You said you got all the cysts.
They could reemerge.
I'll go to radiology clinics. I'll get regular screenings.
If something happened while you're up there, you'd be playing Russian roulette with other people.
Relax. She doesn't have to tell, neither do you. Turns out the NASA doctors even know where the hyphen in von Hippel-Lindau goes.
You called them?
I'm not an idiot. Those shuttles fly over New Jersey.